In daily life, people often use the terms sprain and strain to describe any type of soft tissue injury around a joint. Medically speaking, a sprain is an injury to a ligament, which is tough tissue that connects two bones together. The most common sprains include knee, ankle, and wrist sprains. On the other hand, a strain refers to damage to a muscle or tendon, where a tendon is the tissue that connects muscles to bones. Common examples of strains are back strains, hamstring strains, and tennis elbow. Now, let's describe the classical signs and symptoms of a sprain. A sprain typically occurs when a joint is forced beyond its normal range of motion, resulting in stretching or tearing of the ligament. Pain is an almost universal symptom of a sprain. It is immediate and severe, usually localized to the affected joint. Following the injury, swelling develops quickly, contributing to joint stiffness. The third most common symptom is bruising around the joint, which develops due to bleeding from the injured ligament. Reduced function is also common, especially when weight-bearing ligaments such as those in the knee and ankle are injured. Sprains can be mild, moderate, or severe. A mild sprain is more discomfort than pain. If a person describes it as severe pain, it is likely a moderate or severe condition. In a mild sprain, the joint is usually functional, but the person may experience slight discomfort during activity. A moderate or grade 2 sprain involves a partial tearing of the ligament. The pain is more severe and acute, occurring during physical activity or when pressure is applied to the affected area. Swelling is usually mild, and joint function is preserved, although it is painful and difficult to use the affected joint normally. Bruising is noticeable, whereas it is almost not noticeable in mild cases. A severe or grade 3 sprain involves a complete tear of the ligament. The joint becomes completely unstable. Pain is very immediate, and swelling develops rapidly. The joint is unstable, meaning the person feels that the joint is loose or unable to support weight or movement effectively. Bruising is typically extensive. A popping sound may be heard at the time of injury when the ligament is completely torn. For confirming and differentiating between grade 2 and grade 3 damage, an MRI, magnetic resonance imaging, test is crucial as they can appear similar. Additionally, the nature of the trauma should be considered during assessment. For example, a slip and fall usually results in a grade 2 or moderate sprain. In contrast, heavy sports collisions, like those in rugby, car accidents, or falls from a height, for instance, from a ladder, are more likely to cause grade 3 or severe sprains. Factors that increase the risk of sprains include age, as muscles weaken and ligaments become less flexible over time. Sprains are also more common among women, and sports activities increase the risk of sprains. Footwear is very important in preventing sprains. It's advisable to avoid shoes with slippery soles and those that are worn out. The first-line treatment for sprains is the R.I.C.E method, which stands for rest, ice, compression, and elevation. Avoid activities that cause pain and get rest. Use cold packs for 20 minutes at a time, several times a day, if there is significant inflammation and swelling. Do not apply ice directly to the skin. Elastic compression can help reduce swelling. Pain and inflammation can be managed with ibuprofen, naproxen, and paracetamol. Use braces and immobilization if needed. Once the pain subsides, start gentle exercises and gradually increase physical activity. In the case of a third-degree sprain, the first-line treatment is immobilization to allow the ligament time to heal. If the ligament is completely torn, surgery may be required, followed by physical therapy and gradual exercises to restore the function of the joint. Some ligaments, even when completely torn, can recover without surgery, with adequate physical therapy and complete immobilization. For example, the medial collateral ligament (MCL) in the knee can often heal on its own.